Okay, start. A very good afternoon to one and all, and here from Institute of Neurosciences at AIG hospitals. Today is a very important day which constitutes a major disease actually per se. That's epilepsy. So in India it's celebrated as a National Epilepsy Day. That's November 17th. Why do we celebrate any day? To give importance to that, to take out the stigma out of that, and to make people aware of the disease. That's why most of these disease, and to get together people suffering from similar kind of disease. That's why we try to do something, some educative or some informative talk with our people. So about epilepsy. So with me we have Dr. Suresh Babu. He is a consultant neurologist and epileptologist. He specializes on medical epilepsy and diagnosis and EEG workups. And with him is Dr. Raghu. Raghu is a fellow in epilepsy and functional neurosurgery, which takes care of the surgical part of all the epilepsy surgeries in our department, the neurosciences. So besides these two, we have the radiologist, nuclear medicine and everything which constitutes the epilepsy board or the epilepsy team. Any case coming in is discussed in these forum, and then we go ahead. So we'll start with the basic questions about epilepsy. To Dr. Suresh, how do we tell a general public know that's in epilepsy or something else, or a syncope or a fainting attack? How do we diagnose that?
So epilepsy is mostly a clinical diagnosis. We depend on what the information given by the caregiver, exactly what happens during the event. Most of the time the precise information given by the caregivers will help in differentiating the what's are asked, how do you know it is really a seizure or not. It is the information given by the people who witness it is more important than any other investigation in making the diagnosis of a epilepsy or seizure.
Thank you, Dr. Suresh. Dr. Raghu, a very general question. What is the prevalence of epilepsy? Number 1 point. What percentage of these patients actually reach the hospital to get a proper treatment, may it be medical? And what percentage of the patients require further treatment, advanced treatments like surgery or stimulation or lesionectomies or these things? So step by step, can you tell on these?
Epilepsy or the fits, usually it is associated with a social stigma, particularly in developing countries. So as per the WHO analysis, data, there are around 50 million population who are suffering from epilepsy. And in India, around 10 million people, which means around 1 crore people are suffering from epilepsy. So out of them, people who are not taking the proper treatment, if you see who are not reaching the hospital, or who are taking the treatment but not taking the appropriate and adequate dose of anti-epileptic drugs at the workup, if you see that thing in urban area, it's around 25% of the people are not taking the treatment at all. And coming to the village population is almost around 50%. So most of these patients with the fits, they assume that they are possessed by someone. They are going to babas instead of a healthcare people. So that is the one thing. So in that thing, the people who can undergo surgery and get seizure freedom, around 1 million people in the overall population. But if you take the average statistics of India, hardly we are crossing 500 surgeries in a year for a almost 1 lakh people of patients.
We'll come to that in detail about something on that later on in our discussion. Dr. Suresh, is there any risk factor for epilepsy? Number 1 point. And when we talk of risk, what are the risks of an epilepsy patient? First is, what are the risk factors of epilepsy? And second is, what are the risks these patients with epilepsy may face?
There is nothing, not the specific risk factor for epilepsy. For example, like a already known epileptic, not taking the drug is a risk factor. And what we see in our clinical practice are the One is a most common is a genetic epilepsies, idiopathic generalized epilepsies, and they are very sensitive to the treatment, and most of the time these people lack of the sleep or the drug default. These are the two common things we notice. A person who was very well controlled for 1 year and suddenly get a 1 fit. So one is a don't miss the drug, and the second one is a lack of sleep or high levels of the stress. Means it is very difficult to define what is high level of the stress. The stress which is high level for one person may be a moderate or low for the other person. So what is bearable for him in a day-to-day activities, and the adequate sleep and the daily intake of the drug. These are the three important things. When it comes to the what are the risk factors, most common is any scar in the brain, either road traffic accident or the seizures when you are a children, febrile seizure, especially what happens in a less than 6 years old child. These two are the very common, and the third one is any focal cortical dysplasias or any like a benign tumors in the brain. These are the common risk factors why somebody can get the epilepsy.
And what are these patients who have epilepsy? What are the risks for them actually in day-to-day life?
Yeah, in a day-to-day life, in a adequately controlled epilepsy, like a two kind of things we have to see. One is the drug causing the problem, or is the seizure causing the problem. If we give the drug which is controlling the seizures, but at the same time if it is causing the sedation or the imbalance, obviously the person will not use the drug. So we have to see really that drug fits for that patient or not, and that dose fits for the patient or not. So that is about the side effect. Epilepsy per se, like it depends upon the situation when he gets the seizure. If he gets during the driving, or if he gets during the cooking, or if he gets during the any unnatural position on the corner of the building or the while walking on the road. So those are the safety issues associated with the epilepsy.
So do you allow them to do those driving, cooking and these things?
Ideally,
People who have well controlled epilepsy, can they do all of these things?
Like what the international law what we follow is from the UK, and according to this we see that at least 6 months of the seizure freedom with the medication we can allow them for the driving.
Yeah, very important point. Everyone should note that these people are prone for any of these accidents if they have frequent seizures. So you have to be careful on that. If you are well controlled, then you can do all these activities. Better to be careful in the first 6 months once you start the treatment. Both of you, first Suresh and then Raghu, in short, when we talk of treatment available for epilepsy, what are the treatments available now, and how it has changed over a period of time?
Like like now our approach to the epilepsy is definitely changed in the last decade, in the sense we are identifying the refractory epilepsies in the very early part, and we are giving the option of the surgery for them if they are eligible for it. It is not that everybody with epilepsy we can offer a surgery. Like
a very important point. People come and talk that I have epilepsy, and when my ward has an epilepsy, he is on drugs. Can we stop the drugs and go for surgery? But Dr. Suresh told a very important point. The first line of treatment is at drugs only. If he is well controlled on drugs, to continue on drugs. Correct?
Yes, sir. And the second one is definitely there is a advance, like our interpretation of the EEGs, the quality of the EEGs and the MRI, and now we have a 3T MRI with very thin sections, and the availability of the nuclear medicine. All these helped us in identifying the epileptogenic area in the brain, so that like we can be very confident before going to the resection, like success of the treatment.
And Raghu, when we talk of surgery, surgery has been done for so many years. What has changed in surgery for period that, and when they should go for a surgery? Is it that they should be loaded with medicine, and when they are not responding, then they should come for surgery? Or is there a role for an early surgery in epilepsy patients?
Yes. So as per the guidelines, it says that based on the type of fit the patient had, they are give at least 2 drugs, appropriate drugs, and for the appropriate doses, if they are tried and they are not controlling with the medication, the patient has to undergo surgical evaluation. So to find out where the fit is coming from. If we localize it, then that patient is fit to get cured by the surgery.
So you go for early surgery in those patients?
Yes, even early. There is no
Even-
limited time that
So
has to be tried
very
with
simple.
this.
Let's
Yes.
simplify it. Patient is well controlled on drugs and
Yes.
has a lesion in the brain.
Yes.
Should we go for surgery or should we wait with medication?
So if well controlled with the surgery, again, the lesion, what type of lesion it is. If it is a tumor, or
It
then
will
we
go
have
for
to go
surgery.
for surgery. If it is a simple scar because of trauma, then we have to wait with the
Exactly.
medication.
Very important. So a tumor in the brain can also produce epilepsy, but that has to be investigated and treated appropriately, not wait with medication. Whereas there is a scar or a focal cortical dysplasia, something, some inherent problems of the brain which don't change over dynamics, they don't grow in size over a period of time. If they are well controlled with epilepsy, or the what Dr. Suresh told about idiopathic epilepsy, these people are well controlled, can continue. The role of surgery comes when it becomes intractable. Two
And-
lines about intractable.
Yes, sir. Like a refractoriness, we can determine with the first drug itself. If somebody on appropriate dose of the first drug, if still they are getting the seizure, means that is the first indication that we are going to deal with the refractory epilepsy, and this patient requires a care more than what regular person requires. So identify the people when the first drug failed itself, open your eyes and see that what is like, because by adding the second drug and third drug, we know that we are not able to achieve the success much more.
And any person walking into the OPD and asks, sir, why did I get it? So if the question comes down to the fundamental, is epilepsy preventable?
See, epilepsy is not preventable because if it is even the genetic epilepsies, they are all multifactorial. Very few are the single gene related. So in a multifactorial, we don't have a complete control over it. And the remaining things are all the symptomatic focal epilepsies. See, so many people will get the febrile seizures. We know who is going to land with the mesial temporal sclerosis. So it is very difficult to categorize or the predict
Except infective causes.
infective causes.
Infective causes, post-trauma and these things, yes. We cannot prevent some of them, yes. But we can try to identify the cause in many of these patients. But the majority of these patients come in the category of idiopathic epilepsy, where exactly what we don't know what is the cause. And as Dr. Suresh told, some genetic basis on that may be associated with it. For the general kids and adults, a triggering factor you told about sleep and these things, but nowadays everyone will ask about a laptop, computer or phones. So is it that over usage or over exposure to that can precipitate an epilepsy?
Not the over usage, but there is a few, most of the genetic epilepsies have a photosensitivity. So frequent changing of the light or the flickering lights, they can sometimes precipitate the seizures.
Yeah, watching something in a dark room, especially you are watching some TV and these things and you are frequently changing the channels, that can. So it's a, as he told, so these things, small things in day-to-day life, you have to be careful. Or the kids who play too much of video games. So there also it's in, especially nowadays these video games have a lot of animation and a lot of flashes in that. That can precipitate. You have to be careful in kids regarding that. If we are going for a medical therapy and it is not responding, it has become an intractable epilepsy, then we investigate it further to know whether this patient, he or she, is suitable for surgery. So there are different types of surgery. If I ask Raghu, what's the fundamental basic success rate of any surgery for epilepsy surgery?
So for a patient who is like suitable for surgical cure, the probable success is around 70 to 80%.
What is success? Meaning of what is the meaning of success?
Rate is like complete seizure freedom. So patient who has the fits and after surgery the chance of become complete free from the fits.
On medication, off
Of-
medication?
so we decrease the medication, like at least we'll wait after surgery if they are not having any fits, like 6 months to 1 year, and then we gradually taper them off. So they might be continuing one drug lifetime, but they are seizure free. So around 70 to 80% of the people are seizure free, may continue need to continue one medication for life at lowest possible dose.
So it's a very important thing. A surgical cure, a surgery, or a treatment modality which can offer 70 to 80% success rate, especially in epilepsy patients, is a very significant thing. And we should all keep in mind that there is a treatment or option available for these children or the adults who don't respond conventionally to medication. So is there any long-term side effect or sequelae of these epilepsy surgeries?
So rather than surgery, I say there are side effects of not controlling seizures. So if a child who is growing in mentally during the schooling and all, if the seizure is occurring which is not controlled, it will have impact on his psychological development, his cognitive functions, which is in terms of his intelligence, in terms of his memory, in terms of other functions, it will seriously affect it. So if the seizure is not controlled, they will lose that capacity gradually over a period of years. So that is why surgery in children, particularly as early as possible, is recommended.
Very important. In the growing age, when the brain is developing and the learning abilities are being acquired that time, if we can, the seizure is well controlled, or we can go for surgery, early surgery in these intractable epilepsy or the refractory epilepsy, it affects the development. It's not only the control of seizure which we are talking of, we are talking of overall development of the child also. So as a caregiver for these epilepsy patients, Dr. Suresh, what special they should learn, they should know to deal with these patients day in and day out?
I think predominantly compliance with the medication, and make sure that they take the medications regularly, and the adequate sleep. I feel these two are the very important in the, at least in a drug sensitive epilepsies. In a drug refractory epilepsies, I think even with the adequate doses they will get the seizures. So we have to look for the other options for them.
Any other thing besides medication which they have to be careful about, the caregivers? It can be the parents, it could be old age people, or it could be a caretaker. Something they should be careful. First thing is medication, as you told. Anything else they have to be careful of?
So when the patient had his fit at house or something, then we should be allow the environment. There should be see that there should not be any further harm because of the seizures. Because if he is on a table or something, make him lie down, or if he had lie down, turn to one side, so that the secretions which we pool in the pools in the mouth, that can drain out. So if not, they can go to lungs and they cause respiratory issues. And never try to hold the patient, calm down the patient while having seizure. Let him have the seizure. It will terminate in 1 or 2 minutes. If not, more than 5 minutes, get them to the hospital in case of status epilepticus, which we call.
That comes down to the fundamental question that in emergency, you see a patient in outside, not in the hospital scenario, patient has a seizure. So 1, 2, 3, 4 do's, 1, 2, 3, 4 don'ts. So it's clear for the patient.
First thing, there is no need to get panicked. That's the first thing. So make the patient lie down on one side, left side at right side, so that the mouth is clean. Don't hold his arms or legs very tightly. Don't gag him. Like sometimes we put something in the mouth so that they don't bite the tongue or something. That may obstruct the airway. So that's the one important thing. And don't hold the patient because of which.
What he told about don't gag it, we should do something between the teeth so that he doesn't have a tongue bite.
Okay.
The concept of putting a steel thing in the mouth came from that actually. It was to prevent a teeth bite, but people thought that you put an iron rod or iron spoon, a steel spoon in the mouth, then the fits will stop. No, it is basically put something in the mouth between the jaws to prevent a teeth bite on the tongue.
Yeah.
And yeah,
If not, like if it is not possible to put or something, if not adequately educated to put what they want to put, just leave it. It's a tongue bite, it won't harm the patient. It will be a discomfort, but yes, that's the one thing.
and call the nearest hospital wherever you are, take the patient there, check out. And other advice for me, for the from my for the everyone, is that any patient is having epilepsy and these things, it's always good to carry a small health card in your pocket, your disease and what are the medications you're taking, and emergency contact number. So that is meant for any of these major illnesses, but epilepsy is such that it can proceed anytime, anywhere. So if you carry a small health card in your wallet or in your pocket, giving your details, contact number, what is your and what are the medications you are, it will be very, very helpful for the people there, and also for whichever hospital you are being taken to, it will be very helpful. Dr. Suresh, the last question: does epilepsy have an age? Having seizure, does it have an age bar?
There is no age bar, sir. You can get from the infant to the like a very old age. We see two kinds. One is a very young brain and very old brain are prone for the seizures. That is why you see very frequent seizures in a children, even with the fever or any something which is acute. Same thing happens in the old age also. More than 75, 80, just we will see the degenerated brain producing the fits. So these are the age groups which are more prone for the seizures.
So epilepsy doesn't have any age bar. So does treatment doesn't have any age bar. So all the patients should be taken care equally, with equal care for the caregivers and the caretakers, and address and reach a nearest hospital, get yourself evaluated by a neurophysician, neurologist or an epileptologist, and start medication as early as possible so as to prevent a second attack. So thank you, Dr. Suresh and Dr. Raghu, on this National Epilepsy Day, hoping that everyone remain healthy, and a facility which is there, a team of doctors treating epilepsy is available at our Institute of Neuroscience at AIG hospitals, and for anything you can call up or visit our center for further guidance. Thank you very much and have a great day.
Thank you.